Good day, my name is Christine Somera, and today I will be talking about adolescent therapy, a specialized field that focuses on handling adolescent therapy with the use of different psychotherapy approaches. For this topic, I'll briefly introduce what adolescent therapy is. We're also going to learn the difference on administering individual based and group based therapy for adolescents. And then we will focus on discussing five major approaches to adolescent therapy. And lastly, I'll give an overview of an adolescent psychotherapy treatment planner. According to L.R. Nost, it is not our job to toughen our children up to face a cruel and heartless world. It is our job to raise children who will make the world a little less cruel and heartless. This quote implies that we can help children or adolescents to grow into a healthy person, both physically and mentally, by providing them the necessary help or therapy when they are going through something. The adolescence stage from 12 to 19 years old is the fifth stage in Erik Erikson's stages of psychosocial development. At this stage, the individual experiences a conflict between identity and role confusion. The influential figures at this stage are the teachers and significant others, and the adolescent develop the basic strength of fidelity. As you can see here, Erickson, he claimed that if the adolescent resolved the conflict between the two, he or she may have a favorable result of developing sense of self and identity, plans to actualize one's abilities, and develops the ability to stay true to oneself. However, feeling of confusion, indecisiveness, and antisocial behavior, and a weak sense of self might occur as an unfavorable result. This is the stage where individuals begin to experiment with different lifestyles, such as in terms of education, work, political, and social activities. Here you can see the problems that an adolescent might encounter or face with the possible accompanying disorder or issues that they may face. For instance, academic underachievement may result to becoming an overweight, obese, or bipolar disorder. Adoption may lead to blended family or obsessive compulsive disorder. Anger control problems can result to conduct disorder or being delinquent, negative peer influences, etc. At the same time, we have anxiety, which can result to peer or sibling conflict, substance abuse, and the like. Okay, we also have here ADHD or the attention deficit hyperactivity disorder, which may result to eating disorder, low self-esteem, etc. And of course, autism. Spectrum disorder may lead to grief, sexual identity confusion, among others. Please take note that these are just some of the problems that adolescents might encounter. There might still be others not covered here. Okay, you can see in the diagram the different approaches that can be used for adolescent therapy. Considering the specific problem of the client and preference of the therapist, one can use the solution focused therapy, cognitive behavioral therapy, reality therapy, systemic therapy, AC therapy, or the acceptance and commitment therapy, and of course, other approaches not mentioned here as long as it relates to the adolescent's issue or problem. We will just focus on these six frequently used for adolescent therapy. Okay, so let us first tackle acceptance and commitment therapy or ACT. It can be administered individually or by groups. The focus of the ACT is on awareness and allowing, workability, and values-based behavior. It specifically targets avoidance, the primary strategy of adolescent clients to avoid hurt and rejection. For the individual therapy, it can be used for adolescent clients who struggles in anxiety, depression, eating disorders, relationship problems, substance abuse, and self-harm. While the group-based therapy, it can work well with clients that have common domains and interpersonal dilemmas. Since some of the adolescents who undergo some obstacles are often immobilized at home, unable to attend the school or socialize with their peers, the ACT approach helps the clients to feel better and to step back into their lives. Okay, we have here the ACT for adolescents. Okay, so it is a book by Torrell and Bell, published on 2016. They have comprehensively explained each of the 10 sessions that you can see here involved in ACT. So let's go discuss each of these sessions. Okay, session one, the assessment. At this stage, the therapist will gather information about what your what your client avoids and how she avoids it. Okay, so this can be done through introducing the concept of thoughts or distraction, opting out time travel, and a self-harm, which opens the door for the next session. Moreover, this is also the stage to learn about the client's values. Okay, so if you are the therapist, you must remember that you should possess the following characteristics. Okay, so non-judgmental, empathic, and the need to accept any strategies that patients have already tried. Okay, so for the next session, we have creative hopelessness. Okay, so these focuses in discussion, experiential experiences, and metaphors focusing on mindfulness, the inner events or behaviors. Okay, so the thoughts, emotions, physical sensations, and urges that humans try to get rid of. This is the stage where illusion of control is introduced so that clients discover their own sense of creative hopelessness. Integrating the matrix DOTS in this session allows an opportunity for clients to deepen the work on noticing their behavior both inside and outside and the workability of their behavior. Okay. Now, session three, identifying values. Okay, so the focus of this session is to help clients identify their values while learning to differentiate between values and goals and values and rules. And it ends with choosing a step they might take toward those values. The activities here include recalling what is stuck in the last session, mindfulness, an inquiry into values, the cue card, then go back to mindfulness. Okay, now comes the setting of goals in session 4. This is putting values into action. By the end of this session, you might want clients to have a good idea of their values and several next steps that they can try to take between now and the next session. Reminding them to change their language to I'm having the thought that or I have feelings of can be helpful, and ending with a reminder of the first L in Yama will give them something to work with. Know what Yama stands for at the next slide. Okay, so this is the goals worksheet and LLAMA. Okay, so we have here, the L, label thoughts, L, let go of the struggle, A, allow thoughts and feelings, and mindfulness, A, approach what's important, etc. Okay, so now what do we expect at session 5? Okay, willingness and allowing of feelings. Okay, so by the end of this session, your client understands Liyama and has some experience in using these steps in allowing feelings and thoughts, although the latter is expanded upon in the next session. As she moves ahead with value based goals, willingness, and allowing of feelings is crucial. Practicing this instance will be important throughout the remainder of your work as a therapist with her. So, an experiential exercise here includes jumping off a chair. Okay, so we have next session 6, diffusing from thoughts. Okay, so what do we expect to happen now? Client has a sense of how Yama works from beginning to end and can identify and practice ways to use each of these steps in the acronym as she moves in the direction of her values. Okay, so an example of diffusion exercise is singing. Okay, so afterwards, okay, the client will now diffuse from story, which means client may have a sense of her own story and ways in which to use Yama to diffuse from it and move in the direction of her values. We use the word story to stand for the collection of thoughts that a client has about herself. It will be important to give our adolescent client a safe, compassionate relationship in which to share her story and her sadness, anxiety, shame, self doubt, and other feelings that are connected to the story. So once we have a genuine sense of our client's story, we can help her to diffuse not only from individual thoughts, but from her story, from her self as content. Okay, so in session 8, the therapist will hear about the client's self as context or her conceptualized self. So, client may have a felt change of who he is and how he defines himself, and a compassion and understanding of who he has been and the ways in which he tried to cope. We want to remind our clients of past experiences that connect to their sense of their self as an observer and thus to develop their sense of awareness in any given moment. Okay, so in this session, we provide experiential exercises to help clarify the concept and, more importantly, to experience being the one who notices and is aware. Because our clients' sense of who they are often centers around being not good enough in one form or another, we also focus on self compassion in this session and include a mindfulness meditation to help clients loosen their grip on their conceptualized self and the shame that often accompanies their self. Okay, so in session 9, this highlights self compassion. which may experience that can help to reduce her judgment of herself and others and loosen her grip on her conceptualized self, making more room for self context and increasing behavioral flexibility. Your presence as a caring and interested therapist will likely have been impacting your client's self compassion all along. Meditation is included to help clients with their sense of self compassion and acceptance of who they have been, who they are now, and who they want to be. So now in session 10 will be the stage to pull everything together that has happened in the duration of the therapy sessions. So make sure the client have your contact number in case questions come up in the future. You can set a schedule such as a 3-month follow-up session for both individual clients and group members. Okay, so now, let us discuss other approaches that might be useful for adolescents. So, we have here the CBT or the cognitive behavior therapy. Okay, so clinicians who will use the CBT to adolescents should consider the reciprocal interaction between internal thoughts and external comparisons that can create a litany of potential cognitive distortions, many of which can interfere with daily functioning and the disorders themselves, such as depression and anxiety. So, the table consists the necessary components that will be used on using CBT with adolescents' depression and anxiety. Okay, so you can see that for depression, psychoeducation involves teaching the adolescents and their family about the disorder, including how depression is conceptualized from the standpoint of CBT. Okay, so while in anxiety, it involves teaching the child and family how and why excessive levels of anxiety are learned and maintained. Okay, so and the rationale for various treatment techniques. Okay. CBT is also applicable on cases like parenting, adolescents' aggression, and many related constructs such as on anger, hostility, and impulsivity. Okay, next, we can also apply rational emotive behavior therapy techniques. Okay, so these involve asking clients to assess the consequences of their emotional and behavioral responses in a Socratic fashion. However, it is important to take note that developmental considerations between children and adolescents are important before applying the REBT. According to Prout and Fedewa 2015, okay, so psychotherapists need to assess each child's and adolescent's stage of change and agreement on the goals of therapy before proceeding with any REBT interventions. If the child or adolescent does not desire to change, motivational interviewing could be used to accomplish the task. Okay, so this technique is applicable for adolescents with low self esteem. Okay, next, we can also apply reality therapy approach for cases like adoption. This aims to lead the client towards acceptance of responsibility by individuals for their own behavior, thus helping them to achieve success and happiness. This approach can teach the adolescents better ways of fulfilling needs. It encourages human involvement and supportive confrontation where the adolescent can learn how to behave in a more responsible and productive manner. Okay, so solution focused approach is also helpful for adolescents, especially the ones undergoing substance abuse. It can also be applied to adolescents who experience stress, anxiety, and school behavior, adolescents with developmental disabilities, children who struggle with obesity, among others. This practice highlights the collaborative and client driven aspect, which is helpful in encouraging groups of young people to take more responsibility for developing solutions based on their successes, strengths, and wisdom. Okay. Lastly, we have systematic approach such family therapy for adolescents. This aims to provide assistance on children, adolescents, and families. Okay, so family therapy research has focused on psychomatic disorders, juvenile delinquency, and conduct disorders, and mixed emotional or behavioral disorders. Okay, so here is the Adolescent Psychotherapy Treatment Planner I have mentioned a while ago. So it is by Arthur Jongsma and colleagues. Okay, so this one is very helpful for therapists who may want to look for a guide as well. So this treatment planner for adolescent psychotherapy includes sample treatment plan for academic underachievement, adaptation, anger control problems, anxiety, ADHD, autism spectrum disorder, bipolar disorder, blended family, conduct disorder, divorce reaction, eating disorder, grief or loss unresolved, intellectual development disorder, low self esteem, medical condition, negative peer influences, OCD, oppositional defiant disorder, overweight or obesity, panic or agoraphobia, parenting, peer or sibling conflict, physical or emotional abuse victim, PTSD, psychoticism, runaway, school violence perpetrator, sexual abuse perpetrator, sexual abuse victim, sexual identity confusion, sexual promiscuity, social anxiety, specific phobia, substance abuse, suicidal ideation, and unipolar ideation. Okay, so these are my references. Okay, so that's all. Thank you.